Next, I call upon Dr. Dileep Kumar. He's a senior retina consultant and medical director of Shantiram Eye Hospital, Kurnool. He is trained in vitro-retina under Dr. Mahesh Shanmugam Shankara Eye Hospital. Over to you, Dr. Dileep.
Good afternoon, one and all. I will be talking to you about the recent updates in retina. So, ultra-wide field imaging. Any image beyond 50 degrees is termed as wide field, and in ultra-wide field, it captures up to 200 degree. So, Octa can capture up to 55 degree. This is a slide which depicts an ultra-wide field OCT and an OCT angiography in a case of ITBRVO, where you can see a non-perfusion area in the inferotemporal quadrant, which is similar what you can see with the fundus fluorescent angiography. And this is a comparison between an OCT angiography and an FFA, wherein you can see that because of the dye leakage, the abnormal vasculature is not very clearly seen in a traditional fluorescent angiography. How do we put this into clinical practice? So ultra-wide field fluorescent angiography has a promising role, and it picks up more non-perfusion area and peripheral neovascularization and helps in grading of DR even more compared to a traditional FFA. OCT helps us to assess the PVD status and helps us the dissection in plane of dissection in the VR surgery. Octa still ultra-wide field has not matched up to the role because of its acquisition time and the artifacts associated with it. And in other retinal disorders, ultra-wide field, especially in pediatric retina like Coats disease, the peripheral telangiectatic vessels can be easily seen. And in FEVR, the peripheral non-perfusion area and where we can do a targeted laser is seen. Uveitis, vasculitis can be picked up, and more cases are diagnosed because of this ultra-wide field imaging. One other use of fluorescent angiography is intraoperatively. We just attach an exciter filter to the microscope and it tells us microvascular leakage, non-perfusion and vascular filling. Based on this, we can reduce the post-operative vitreous hemorrhage incidence reduction because we can target the areas during surgery wherein when it shows non-perfusion area and we have skipped anything, so immediately we can do laser. And also better delamination of the membranes is possible because of the contrast it induces. So this is a photograph showing where a surgeon easily delaminates the membrane nasal to the disc with the help of dye. Geographic atrophy, this is the most talked about everywhere now. So until now we were not having any treatment for this, but now recently FDA has approved 2 drugs, anti-complement drugs, that is pegcetacoplan and avastin captod pegol, which can be injected monthly or alternate month, but one has to remember that it doesn't delay progress, it doesn't halt the disease, it just delays the progression. So the most important side effect to be noted during this is the ischemic optic neuropathy and its conversion into wet AMD. This is a photograph where the upper photo right eye shows the patient treated with a pegcetacoplan over a period of 2 years, wherein you can see there is a minimal increase in the size of geographic atrophy, whereas the left eye, which is untreated, you can see considerable increase in the geographic atrophy area. Mactal, another disease which doesn't have treatment until now, has a promising treatment in pipeline which specifically targets ciliary neurotrophic factor. It's again a gene therapy which is injected into the vitreous cavity. It is told that it prevents the loss of ellipsoid zone by 36% and also reduces the loss of reading pass speed by 68%. It's pending for approval. The most widely used aflibercept injection now has come up with an high dose with an objective of prolonging ocular VEGF inhibition so that the number of injections comes down. The safety profile is comparable with the normal 2 milligram dosing. So this recent studies have shown that the patient can be with injection-free interval up to 24 weeks. Optogenetics, there's nothing, it's a type of gene therapy. As we all are aware, in advanced retinal degeneration, there is complete loss of photoreceptors. So this photoreceptor has some sensitive protein called as an opsin. So in cases where there is complete loss of photoreceptor, we inject a drug which sensitizes the bipolar cells to induce this opsin protein so that it can transduce the visual pathway again. So one important thing is it is not specific to any genetic mutation and a routine 3-week steroid prophylaxis has to be given. No adverse events have been noted. over a period of 76 weeks, we can notice 56% of improvement is noticed. AI, as in every other field, even in retina, it is possible because of the imaging nature of the retina. Deep learning module is most commonly used. These are the various applications and the devices which are used. Most commonly, AI is used in diabetic retinopathy for grading, predicting, and prognosticating as well. ROP and automation is possible now. It can easily predict into whether this eye or the baby would develop into stage 2 or stage 3 and guides us in the treatment, and also classifying the diseases in AMD. The only disadvantage is with the black box phenomenon, that is, we are left out with inputs and outputs, but we do not know the reasoning why, how did the machine gives us this data, apart from we giving us input. This is the only thing we are kept hidden about that. One interesting thing is in surgical retina is about using AI in retinal detachment. The most common question is in an RD surgery, the patient would ask us, will I get my vision back? So using this AI, apart from macula on and off status, we can incorporate macular OCT and ultra wide field imaging using a fusion model. It takes into consideration height of the foveal detachment, the ellipsoids on breaks, outer retinal corrugation, and tells whether the patient will develop vision beyond 618 or less than 680. So this is the same thing which is the model. And the last is robotics in retinal surgery. So with the advent of subretinal injection and gene therapy, precision and elimination of hand tremors has been imperative. So robotics is used very commonly in these procedures like macular surgery, subretinal injection, and retinal vein cannulation. In the surgical state, two systems are available now, that is precise surgical system and KU Leuven manipulator system. A robotic device would consist of a motion controller with an instrument manipulator, wherein you can load the forceps or a needle or any other desirable instruments where you need to work on, and it is integrated with OCT so that you know the positioning of the tool and its precision. The resolution of the precision is up to 10 microns. This is a photograph where a surgeon is sitting and doing a subretinal injection. You can see the right hand is handling the motion controller, and you can see this is the instrument manipulator, wherein the instrument injection needle forceps can be loaded onto it. It has a conical tip which is docked into this adapter, and the procedure is carried out. So this has a precision and more thing. It's very importantly used in subretinal injection and gene therapy. Thank you.
That was an excellent talk. Thank you very much. Do any of the audience have a question?
So that was about the optogenetics, was very fascinating. So is it, is it being...
no, ma'am, it is still in phase 3.
It's phase 3, it's
yeah,
not come out,
They
right?
are
Because
doing it for Stargardt's and retinitis
yeah,
pigmentosa.
that's what, it's showed very promising results.
Yes, ma'am.